President Trump pitching a whole new vision for American health care after Obamacare became a key sticking point in the shutdown talks. He says Trump care will be both more effective and more affordable. President Trump broke how his plan would work in an interview last night with Laura Ingraham.
The premiums have gone up like rocket ships, and I'm not just talking about recent. I want, instead of going to the insurance companies, I want the money to go into an account for people where the people buy their own health insurance. It's so good. The insurance will be better. It'll cost less. Everybody's going to be happy. They're going to feel like entrepreneurs. They're actually able to go out and negotiate their own health insurance.
All right, let's bring in Dr. Mehmet Oz, Centers for Medicare and Medicaid Services Administrator, to discuss this. Dr. Oz, welcome to you. Good to get you back on the program. So what would Trump care look like?
Well, these are all ideas that we're still working on, in part because until the government shutdown formally ends, we don't have all the people in the room who need to work on these programs, including actuaries and insurance experts. But let me take a step back and explain why the president feels so passionately about this. And, if you've noticed, there have been quite a few things on the agenda around health, and not just because Secretary Kennedy is pushing the MAHA agenda, but because MAHA really means making it easier to be healthy in America. So the most favored nation drug pricing, which you've been following over the last month, where we've taken the leading U.S. company, leading European company, the fertility drugs, and just last week, the GLP-1 weight loss drugs, and gotten those prices down to where other people in the world pay them. No longer will there be global freeloading where Americans are paying 3 times more for the same product in the same bottle made in the same factory. That's part of a larger strategy the president has embraced of negotiating. You heard him say it in that little clip from Laura last night. So the fundamental question is, how do we empower people? And what the Democrats did during COVID, and the Obamacare system was out there working, whatever, but during COVID, there was an additional layer of incentives, of money thrown at the problem, which has historically been how, unfortunately, Democrats deal with these issues. They see an issue and they just throw cash at it, hoping someone will figure it out. In this case, some of that money got pocketed, but I'm going to share with you numbers that will blow your mind. And these are the actual numbers from CMS. We believe 4.4 million people are not appropriately enrolled in Obamacare, which means they're phantoms. They don't know they have the insurance. They don't want the insurance. They didn't need the insurance. They're already enrolled in some other policy. So we as taxpayers are paying for 4.4 million people to have full benefits for no good reason. And when you check into behind the scenes of why this is happening, when the Obamacare additional COVID credits were added in 2021, beginning of the pandemic, there were about 3.5, 4 million people who were never using their policies. And that's normal. Sometimes people don't use their insurance policy. Today, it's over 11 million people who have Obamacare never use their policies. They don't buy medications with it. They don't see doctors and use it, which means they often don't know they have it. And yet we're still stuck with the bill. The president doesn't want that anymore. He wants the waste, fraud, and abuse taken out of the system. He wants to take care of the people getting the ACA, Obamacare's insurance, and we want to bring privately carried people into the system as well, and that's what he's talking about. Let Americans use their money wisely. Allow people in the private sector to also use the exchanges. When Obamacare was created, they take a step back, because this is the original vision. 50% of the people on Obamacare were supposed to be paid for by the government. 50% were supposed to be spending their own money. Now it's 95% government funded because we drove out all the private sector people by overpaying into the system.
Yeah, I remember when all that happened. And in this big debate over health care, the minority leader in the House, Hakeem Jeffries, took an opportunity yesterday to say some rather unkind things about you. Here's what he said.
Nobody who's serious in this country takes Dr. Oz seriously. No one. And I mean, it's shocking that the guy even was confirmed. I'm not going to respond to any comments from randos like Dr. Oz, who is woefully unqualified to be in whatever position he holds in the administration. He's a joke.
So, Dr. Oz, you and I have known each other for about 30 years now, and I put together this little collection of potential qualifications that you have. You did your undergraduate degree at Harvard. You did your MB at UPenn. At the same time, you did an MBA at UPenn's Wharton School. You're a renowned cardiothoracic surgeon at Columbia Presbyterian Hospital. That's when you and I first met. You created the complementary medicine program at Columbia Presbyterian. You're a professor emeritus of Columbia University. You invented the mitral valve clip. Harvard called you one of its 100 most influential alumni. And Time Magazine named you one of its 100 most influential people. So do you want to take a moment here to respond to the minority leader?
Well, Congressman Jeffries panicked. You know, he didn't understand the message that's an important one, so he tried to attack the messenger with an ad hominem approach. But, you know, that's not how you deal with the challenges that 24 million people are facing now, because the Democratic Party has not been able to really put forward a program that could work. Just throwing more money at it is not a strategy. That's a tactic that has already created immense amounts of fraud in the system, as I outlined. What I need Congressman Jeffries to understand is there are people in his district who are getting Obamacare and don't know they have it. We believe hundreds of thousands of people around the country are getting tax forms from the IRS claiming they have bought Obamacare where they have no knowledge about it, whether it's corrupt brokers or mistakes, or no one ever bothered asking them. But the congressman in his own district has this problem. All he's got to do is open his eyes and ears and listen to what's going on. And this is what's destroying the exchanges. This is what we're trying to do in this administration. We're trying to save Medicaid, save the ACA. You save it by making smart policies so that people who are vulnerable, who desperately need these programs, will have them for years to come. And you make sure folks who are not supposed to be on them, or don't even know they're on those programs, are not taken advantage of them. You definitely don't give the money away to the insurance industry. When you have insurance companies making 10 times increase in valuation, it's because money's being thrown at a problem and it's not going to the actual issues.
Considering you've labeled him woefully misinformed, I wonder, Dr. Oz, maybe schedule a meeting with him.
I would welcome a meeting with Congressman Jeffries. I would welcome meetings with Democrats and Republicans. Healthcare should be a bipartisan effort. I actually have met with all the Democratic governors that I can get my arms around as part of the One Big Beautiful Bill's effort to change rural healthcare. As you know, putting $50 billion into that program. I'm out there talking to Democratic leaders all the time. What I don't want folks to walk away from this interaction believing is the Democratic Party actually has a strategy when it comes to the fraud, waste, and abuse in Obamacare. They don't. And their desire to just insist on putting more money into it, or they're going to shut the government down, is a woefully misinformed approach. Fix the underlying problems of the system, and we'll have enough money to go around.
Well,
if you don't deal with that dam, it's going to break.
I don't think anybody meets you and thinks, oh, that rando doctor. Unqualified Dr. Oz.
I'd like to be a fly on the wall in that meeting with you and Hakeem Jeffries. UPenn versus NYU. That'll be a matchup.
We're done. I'm on.
Always great to have you, Dr. Oz. Thank you.
Thanks, Doc. Good to see you again.
Okay.
Bless you.
Hey, Sean Hannity here. Hey, click here to subscribe to Fox News YouTube page and catch our hottest interviews and most compelling analysis. You will not get it anywhere else.